New research warns that supplies of essential medicines could reach crisis levels unless there's an overhaul of the system. Doctors say Australia is too reliant on big overseas manufacturers for drugs such as cancer treatments and anaesthetics. But the pharmaceutical regulator has dismissed the findings and says Australia has one of the best healthcare systems in the world.
The medical world is still reeling from news that stocks of penicillin are dangerously low. Now, new research published in the Medical Journal of Australia shows the problem could be more widespread.
The specific medications that I thought we were most vulnerable in regards to were the acute care medications, particularly intravenous fluids, analgesics, antibiotics.
Dr Simon Quilty and his team investigated supplies of these essential drugs and, on average, hospital pharmacies had just 1 month's supply. Researchers warn the system is vulnerable because it relies on cheap generic brands manufactured in China and India.
Recognising that this has subsequently led to a weak supply chain, as we've seen with benzoyl penicillin.
Dr Quilty says the drug shortages pose a threat to the public, and some doctors agree.
If drugs aren't available, you make do. But that often means you may be making do with something that's not as good and may particularly be not as good for an individual patient.
But the pharmaceutical regulator has played down the shortages, insisting there's no cause for concern.
It's a storm in a teacup. Yes, Australians should feel lucky that they live in Australia and we have such good systems of medicine supply.
The TGA says it's common for drug supplies to run low. Eliza, ABC News.